Hi everyone, thank you for joining us in this Power Hour this Friday. My name is Maud and I'm an osteopath at Perfect Balance Clinic, and this is Sophie.
Hi, I'm Sophie. I'm an osteopath for Perfect Balance who works in St Albans.
So you might have seen us every Friday now, just talking about different subject. And this Friday we're going to talk about arthritis. So arthritis is extremely common in the general population, and we see a lot in clinics. So there's a lot of people coming with different type of arthritis because there are quite a few different types. So what we're going to do today, we're going to talk a little bit about the different symptoms that you can get. We're going to touch on the different types and also giving you some advice that you can simply do at home, and just explaining a bit how we treat that and what we do with people coming in with those type of pain. So to start with, Sophie, what are the main symptoms that you usually see in clinic with that type of condition?
So with arthritis, it's pretty key to make sure that you've got a diagnosis. You can either get a diagnosis from someone like us, an osteopath, or from your GP. They can get that diagnosis from various different techniques. But if it's someone who has something like osteoarthritis, which is the biggest type of arthritis and the most common type of arthritis in the UK, someone will come in with pretty classic symptoms across the board. So they may have woken up with a bit of ache and pain. They may wake up and they go, I'm really stiff in the mornings. I find that it takes me about an hour, maybe 2 hours before I can really get going, get moving, before I feel like myself. That doesn't mean that you've got a massive limp and you can't use your leg at all. It just means that you just feel a little bit different to what you would normally feel like. You may have some swelling in a specific area, say your knee or around your hip even. You may feel like it's a bit hot, maybe even a bit red, and it's just a little bit puffier around that joint compared to what it would the other knee, or it just looks a little bit different. You may feel like after having a particularly active day, you may feel a bit sore, a bit achy, a bit more than normal in those said areas. Anything else you have to add, Maud?
I think one thing as well, I don't know if you touched on it, it's about, I think you might notice a little bit less range of motion within your joint. For example, if it's your knee, your hip, or something like that, it's like, oh, before I could lift my knee all the way up to my chest, or I could bend my knee all the way up to my foot, all the way up to my buttock, and you're losing those type of movement, or it's decreasing. That might be one of the symptoms as well that you're getting. But definitely that's the type of thing that we're looking for. And I think one thing to mention as well, it's the onset. So when it's starting, usually when you talk about osteoarthritis, which is the main thing that we see, it usually starts gradually. Because it's a condition that affects your joint and that affects the cartilage and the health of your joint. It means that it just last over a long period of time. So it starts really early and then just gradually, years after years, and after you playing tennis, running, doing everything in your lifetime, you then getting a little bit of degeneration going through there, which is going to take quite a while to build up, and then take a while to increase in the pain as well. So they tend to say it started a few months ago and just is getting worse and worse. I feel more stiff. I feel a little bit more swelling, and so all of this increases a little bit more.
Yeah, it's pretty slow onset, and you may even not, you most likely won't notice it at first, and you may even think, oh well, it was after I did that run that I got a little bit sore and a bit achy, so I need to just rest up. And you know, you go 2 weeks and you're just it's still not better yet, and you would expect it to be. Those can be some of the earliest signs of just a bit of wear and tear within the joints. And again, it's really important to note that it's really common. Millions of people in the UK suffer from it, and it doesn't mean that it's only the athletes that get it as well. It can be anyone from any type of work. They can just begin to get that wear and tear, most classically with OA, osteoarthritis, in knees, in your hips, in your back, in your hands, and in your wrists, because those are the joints that humans use the most. So
and it's also those type of joints, especially knees and hips, is the one where we are what we call weight bearing. So that's where all of the force going through the motion. So when you do like jumping, running, even walking and things like that, the force going through your joint. So sometimes those can be the joint a little bit affected a little bit quicker or sooner. But as you said, lots of people have the degeneration within the joints, but don't have the pain. So it doesn't always have to be painful. And it can get better as well. You cannot be as much in pain as you are now if you are having the symptoms. You can get a decrease in your pain, and you can try to get it better by seeing someone, by doing more, we're going to talk a little bit afterwards about what you can do to help it. But I think so often people come with already diagnosis. So to us in clinic, it would be someone that had this type of pain. They then had an X-ray or an MRI, and then they come in saying like, I have a bit of degeneration, wear and tear in this hip. Can you help me with anything? And so there we know exactly what's happening. If someone comes with these type of symptoms, we need to work out what's happening. So the first thing would be to try and work out which type of arthritis it is. And the most commonly is OA, but there's another one that's quite common as well, which is rheumatoid arthritis, isn't it? And that's a little bit more painful. It's a little bit more of everything within that one, and it's different in the start. It's different in the essence, in the physiology of that condition.
Yeah, so it's your immune system triggering that response. So it can react a little bit differently. You can get some of the common symptoms that you would have for osteoarthritis. So sometimes it gets misdiagnosed as osteoarthritis. You know, it starts off at the same period in life with OA and RA. It's people begin to show symptoms sometimes as early as in their mid-40s. You can get the swelling in the same joints. You can get that heat, the redness, the reduced movement. But the difference is that it's actually an immune response rather than just wear and tear, which you would have to get a more specific diagnosis for. With something like RA, there are more specific triggers for it, as in, oh, I can't do that one movement because that will cause this symptom to flare up. That's what it and it might be a bit difficult at first because it's not very clear what's going on, so you may not know what your triggers are.
I think the immune response basically is just, it's called autoimmune disease, so that just means that it's your own body creating a reaction into a joint and just creating that huge inflammation into that joint that then causes you pain and flares up and things like that. So those types of things, we would probably want to get a diagnosis to your GP if we are thinking that you're having something like that. But there is still things to do with the help of your GP, with the help of someone else. There's still things that we can do, and we would treat it as well in a certain way in clinic.
Yeah. So there are some pretty easy things that people can do at home to help themselves. Sometimes especially with osteoarthritis, even just a heat pack on the area could just ease that pain that you're getting, or those aches that you're getting, or it will stop that sort of sensation in your knee. It can feel like a bit of an odd sensation. And that can just help relieve that. Activity as well. We always encourage people with OA to keep active. I know sometimes it doesn't feel like that, and when your body is basically stiff and sore and a bit achy, one thing you don't want to do is make sure that you're still active, but you actually have to keep on being active so that you're getting that fluid flow, you're getting the fluid coming into the joint itself. It's not just static, you're actually getting some movement through there. You can get blood coming through all of your muscles, you're using all of your muscle groups, so that's really important as well.
If the blood is healing, isn't it? So when we're like doing all things about fluid drainage and things like that, it's to help a better circulation through the joints. And if you have better circulation, better blood supply, it means that you're healing better because the nutrients and everything that help with the healing are arriving into your joint faster and more efficiently. So that's the thinking on keeping moving, is the muscle activity. It helps with the blood vessels because they're pumping in and out, and that's how your blood is coming up right towards your heart, and then your heart makes it go down. But you need that muscle contraction to help your blood go back up within your system and to drain everything through your body.
Definitely.
So yeah, active.
Yeah, and we can do certain techniques to try and help that, or we can even do just muscle work so that we can ease some of the tension that you can get in your muscles, because everyone can have tense muscles, especially if you love going for a run or you love going on that bike ride. You may feel a bit tight here or there, and just loosening off those specific muscles can just really benefit you. It just makes you feel a little bit better, which if you're in a bit of pain, that's the best thing to do, really. We can also work through the joints themselves. Sometimes if you have RA, then that can be a bit of a trigger. So that's why it's really important to get the specific diagnosis, because we don't want to mistreat you or treat you, which then causes you to be a bit sore afterwards. So we would try and do specific techniques to help build up that fluid through the joints as well, so that the cartilage in between the joints is nice and bouncy.
What we like to do is, having the joints are like this close together, we like to kind of trying to do a little bit of a gapping through the joint to try to get what we call a little bit of decompression, you opening up, you're stretching the joint and then getting that fluid in and that healing process going.
It sounds a little bit scary, but
it's very gentle.
Yeah, it's very gentle, and even someone like myself who doesn't have arthritis, I think it feels really nice to have that done to myself personally.
Definitely. Nice treatment is always good. I love it.
Absolutely. And this kind of light work can just make you feel a little bit better. The thing with arthritis is that it is something that you'll have for the rest of your life, unless, of course, you get some surgical intervention. That's why some people get replacements of certain joints or certain parts of joints, so they get cartilage put in or injections and things like that, which can be a really beneficial and really good way of treating the arthritis. But that's further along the line, and that will be in conjunction with your GP as well. It's not like we'll just send you off for surgery.
No, so yeah, I think it's about gauging how much. So usually with having a surgery, it'd be when it's really advanced, when you're really lost, like you've completely your range of motion, when it's unbearable to walk on, to use in the morning, it's really painful and things like that. That's when you start thinking maybe going down the line of having a surgery and having it replaced. But even though you will have it for your whole life, having degeneration and just arthritis, it doesn't mean that you can't have periods or the rest of your life without any pain. As we said earlier, some people have degeneration but just never have pain. So it's just about how to manage it, find what works for you, and find the things that help you. And I think one interesting thing as well, it's especially with RA, so rheumatoid arthritis, when there's a lot of inflammation within the body, you can look even further than just physically and musculoskeletal. You can look at the nutrition, look at within the body, what's helping to decrease that inflammation. So the food that you eat comes through your gut and then are absorbed by your gut and then go through your whole body. So what you eat actually affects your joints, affect how you're feeling throughout the day, throughout your life. And so there's some kind of food that you can eat that can help to decrease inflammation, or just to help balancing the body and just being a bit more healthy. So I think one of the good advice would be maybe to talk to someone that knows about that, for example, a nutritionist that can help you with your diet, and maybe cutting a few things that can help to not have these flare-ups, or just overall the morning stiffness decreasing, or things like that.
Definitely. It's you know, it's all about treating the symptoms that you have, and finding out what things really work for you. So what works for one patient won't necessarily work for another one. And, you know, talking to your friend who has arthritis, they may do one thing and another person, it won't work at all, and you'll have to try something else. And that's absolutely fine, because it's so common, and everyone feels things ever so slightly differently within themselves. For example, there are other things you can do, like mobilization techniques like yoga or Pilates, taking classes that are specific for people who aren't as mobile, who have difficulty with range of movement. Even Monica, who works for Perfect Balance, and she was on Power Hour the other night. She does classes for people with low mobility, people who struggle to get onto the floor. So if you can't move on the mat, you can do Pilates in the chair to just make sure that you're getting some better range of movement, using those muscle groups, getting that blood flow and fluid flow through your body. And that can just be really beneficial, not just for your joints, but for you personally. It sends all those good endorphins to your brain and just makes you feel better.
Yeah, I think it's great because we have a lot of different types of classes, and there's for everyone literally. And so there's actually a lot on just mobility, and there's different levels as well. So if you have really decreased mobility or hypermobility as well, but so you can choose exactly what works for you. And I think that chair Pilates sounds really good. You know, it's like you can do that at work if you're if you're busy and things like that.
Exactly.
So that's really helpful.
It's not just for people with arthritis. Anyone can join if they want to.
No, but it does help, because I feel like some people, as they get older with arthritis, they're just going for that walk during the day. It's just it's painful. They feel like they can't move enough. They just, especially at the moment, actually, when you've been shielding, maybe when you've had to stay home and you can't go out, you can still do that exercise, still stay mobile at home without having to go for a run or do something crazy eccentric or crazy sport. You can do this little motion at home just in the morning when you wake up. It's a really nice time to do it, to start to get your joints moving really slowly, your muscle stretching, because the stiffness in the morning is very common, and that's from you haven't moved the whole night, so your joints have kept one position. And when you start moving them as you stand up, they just kind of, it's the first instant of movement takes a little bit of time. And so exercise in the morning, just a bit of stretches before going out of bed, is always a nice thing to wake up. It's a bit of a waking up of the joint, isn't it? Wake up the muscle, wake up the joint, get it moving, and then
we brush our teeth in the morning, we wash our face in the morning, you know, we have our cup of tea or a cup of coffee or a glass of water, whatever, but we don't do anything to wake the rest of our body up. And if that is something that you really struggle with, especially as stiffness in the morning, we can give you stretches to do in bed. You know, the alarm comes off and you just do that 1 minute, 2 minute routine just to wake yourself up, get the joints moving. So when you're weight bearing, you're standing on those affected joints, it's not quite as stiff, it's not quite as stiff. They're a bit more alert, you know. You wake up, your brain wakes up to the alarm clock, but not necessarily your body.
It's still sleeping, it's still in bed. Good. Is anything else that you want to mention with like the help, or any symptoms that you're thinking of?
There are, like we mentioned before, there are different types of arthritis, not just osteoarthritis and rheumatoid arthritis. And we would want there to be a diagnosis for each of those different types of arthritis as well. Some people, a very common type of arthritis for people with psoriasis is psoriatic arthritis. That doesn't mean that if you have psoriasis, you're guaranteed to get that type of arthritis. There are other people who suffer from Crohn's disease or digestive problems who can then develop a different type of arthritis. There can be an arthritis after you've injured a joint, you know, had some substantial damage done to a specific area, which then causes some scar tissue and it hasn't healed as nicely. And then you get some type of arthritis from there. So that's not to say that every single person who comes to see us just has osteoarthritis, and we treat them in a very similar way the whole way through. And we try to make sure that we're specific to each individual patient, treating them for how they're feeling, what works for them. And obviously that specific diagnosis, we always want to make sure that we've got that.
Talking about psoriatic arthritis, so psoriasis is the condition in the skin, so you can have that more at the back of the elbows and the knees. So that's a quite common condition of the skin. However, there's only, I think, 10 to 30% of people having this skin condition that actually develop that type of arthritis. So it's not everyone. So if you do have this condition, don't worry, it's not everyone. And as well, yeah, all of these present probably a little bit differently from a different joint. For example, it's a lot within the joint of the fingers, isn't it? And you get these big nodules, what we call, swelling through the joint of your fingers. With the one that you mentioned with Crohn's and then some digestive issue, that's antherobacteric arthritis. And that's not as common. I haven't seen actually anyone with it. I don't know if you have.
No, I haven't.
But it's an interesting one, and I think it's often a bit misdiagnosed because people wouldn't kind of put it together. But sometimes when you have what you call irritable bowel disease, sometimes you can have a little bit of this arthritis that develops as well. And so it's just arthritis with another condition, and then we just found a new name. So
exactly.
Worry about, but
so I think it's more confusing.
Yeah, so many names and things, but it's all simple. But what's interesting that you said is that we don't treat the condition, we treat the person. I think that's important to say. So we treat depending on what you come in with and what we see and what we feel on your body. So we'd have a look at this range of motion of your joint. We'll have a look how it moves. We'll have a look at the muscle tension, at the joint health. And we won't only look at where that joint is painful. We'll also look at other joints that might have an impact. So if your hip is a bit stiff, you might actually then create some knee pain or some ankle pain. And so we would try to stop this kind of ball rolling of pain, and we'll try and help with getting those other joints moving as much as they can to try to compensate for your hip that moves a little bit less. And so that's how we would try to work through the body.
Yeah, try to treat the body, not the condition.
Yeah.
But yeah, and again, a lot of people talk about pain, and like Maud said before, not everyone feels pain. My little old 81-year-old granny has got a bit of arthritis, and she just finds it annoying because it means she can't go for her hike that she likes to do because it's just a bit irritating for her. And she makes sure she goes for a 2 to 3 hour hike every day. So not everyone, and sometimes you don't want to get your granny to do, your 85-year-old granny to go onto the floor to do an hour yoga session. So we would try to accommodate to that and give her different things that she can do to help her as well.
Yeah, it's to make you feel that you are still able to do all of those things and to support you through it, because some people, as you get older, it's really hard to find that you're not able to do that, but you've done that your whole life. And that's, I think it's a really hard transition to go through, but you can just change it. You can change it around. You can find other ways of doing that thing that you love doing. And so we can help you with that if you need to. But otherwise, if you are kind of feeling that you have this type of symptoms or relating to what we just talked about, just give us a shout in the comment, or comment what you're feeling, or if you need any help, we'll answer and then we'll get back to you as soon as possible. Otherwise, I hope you are all keeping well, and hopefully those little advice that we lined up for you will help. Just a tiny bit of stretches and the heat and things like that.
Keep moving, keep active.
Keep active always. That's our main thing.
Mm-hmm.
But otherwise, I hope everyone's good, and we'll see you next week for another Power Hour. Bye, Sophie.
Bye, Maud. See everyone next week.
Bye, everyone.